Hello everyone. Today we're going to present about student athlete injuries. I'm Ivana.
I'm Jeremy.
I'm Stephanie.
I'm Shanad.
So to begin with, what are athlete/sports injuries? These are injuries that occur when when playing sports. So here we have the five most common injuries. The most common injury are sprains and strains. So this usually happens in your wrist, ankles, or your knees, and they usually prefer it as like pulling your muscle, and this targets your ligaments. And if you stretch it too far or if twist it too far, it could actually tear your muscle or ligament. The next injury would be knee injuries. More than 5 million patients each year report that they have knee issues because of sports injuries, and it could be very serious to the point where it can actually tore your or damage your ligaments or your cartilage in your knees. The next one is your shin splints. This is the pain felt along your tibia in your lower leg, and sometimes the pain can also occur in your foot and your ankle. Usually, runners encounter this kind of injury. The next one would be broken bones. Broken bones or fractures are really common in sports injuries, and if repeated, it can stress the bone over time. It could create more damage and cracks and completely break the bone. Sometimes it can't even recover. And lastly, dislocations. Um, dislocations happen when there's extreme force placed on the bone. The joint can actually be pushed out and be dislocated and not be in the right location. Sports that usually happen um, with dislocations are, for example, football or any physical activities with excessive stretching or chances of falling. So why is this health behavior very important to the public health? One, because of how high the incidence and prevalence is. So 90% of student athletes report some kind of student sport injury occurring to them. 54% of student athletes report being injured while playing. 30, 37% of high school students report that they get strains and sprains when are playing in sport, and 12% of that actually they have concussions. And between 2008 and 2015, more than 300 sports related deaths in the US actually happened. So, how is this relevant to our class, to our course? One, because of the statistics and how high the incidence is that happen each year only in the US. Number two, it's because it can also be prevented. For prevention with sports injuries are one, getting your physical, and two is doing a warm up, stretching, and a proper cool down. And another is proper training and technique, making sure that your techniques or your how you're playing is proper. And another is having the right equipment. Another factor could be making sure you're hydrated and that you always have rest and breaks, that you don't tire your body out. And lastly, there are interventions that can be used, like theories and models. Now I'm going to pass it on to Jeremy.
I'm going to be talking about the risk factors, which are factors that increases the likelihood of the injuries occurring. And so first off, the demographic issues, such as age, and children and teens have a higher risk due to the fact that their bones are still growing, and they may not be aware of the warning signs of an injury, so they may ignore it. Rates and severity of the injury increases with age, and for gender, women are more prone than men for injuries because due because of their physical composition, such as having a wider pelvis area. This can alter the alignment of the knee and the ankle. And as far as educational level goes, high school and college student athletes may be pressured to perform through aches, pains, or injuries in order to get that scholarship or to be recruited to play professional and be paid to play. And for socioeconomic level, those with lower socioeconomic status may not be able to use or purchase proper footwear, gear, or other protective equipments, which in turn can increase their chances of injuries. And also, inadequate nutrition is also a factor. And for environmental influences, those in college, there's time demands, so higher stress and less sleep can reduce focus, which can make injuries more likely. Performance pressures, athletes feeling pressure to always feel 100% or feel well. And for weather, heat related illnesses can be heat exhaustion or a heat stroke. And for they can also experience extreme cold weather, which can lead to muscle and tendon injuries because the elasticity of the tissues are reduced. And inadequate rest and overscheduling can also be a risk factor for these injuries. And the type of sport also plays a factor in the likeliness of these injuries occurring. So, if the sport is collision and contact related. And so, for the next factors, which are culture and cognitive factors, they for culture, there's pressure to perform well in the team. So, the signs and symptoms of injuries and pain may be ignored by the athlete, and some teams may embody the culture of athletes being selfless and may lead to not properly taking care of oneself, which increases the likelihood of injuries. And for cognitive factors, they value the team game so much that they play through an injury, which in turn leads to the worsening of their condition. So a little more than half of student athletes have said that they confess to playing through a game while injured, and fatigue and burnout also plays a factor in these injuries because they can lead to accidental injuries, or if playing through an injury can lead to overuse of those injuries. And another factor would be that they don't know the proper way to stretch, and so knowing the proper ways of stretching can also decrease the likelihood of injuries. And I'm going to pass it on to Stephanie.
Okay, next we have the protective factors. And first is the level of education and just knowing your body. So, like, you have to know your body well enough to know if you are exerting yourself too much and if you should take a break or not. And then the use of proper technique will minimize the stress on your body and limits the risk of an injury from occurring. And then stretching will help keep your muscles flexible and allow for a range of motion. Staying hydrated to regulate your body's processes. And then the use of proper gear and equipment. So, wearing things such as helmets or shoulder pads is very important so that if you ever got hurt, your injury would not be as worse as if you had no protective gear. And then regular checkups to ensure everything is okay and you don't have any underlying issues. And mandatory recovery days. So, like, once a week, you don't work out or you have a light workout so that it gives your body a chance to heal from the week before. And then athletic trainers, because schools with athletic trainers have fewer injuries than those without athletic trainers, because maybe all coaches don't know about sports medicine in depth, and an athletic trainer would be better able to deal with potential injuries. And then for consequences, starting with social, there could be social isolation and loneliness, because the injured athlete has to stay home and recover, and then their teammates would continue to still hang out every day, creating more bonds. And then as a result, the injured person would get left out from that. And then for physical injuries, there's persisting injuries, where if you don't heal right the first time, you'll be more prone to injuring that same part over and over again. And then substance abuse to deal with stress, sleep disturbance, and changes in eating habits. It was found that some student athletes tend to decrease their food intake when they're injured to make up for the fact that they are no longer regularly exercising. And then, if this persists for long periods of time, it can lead to an eating disorder. And then for mental, there's depression because their athletic career could be at stake if they're out for the remainder of the season, or if it's their senior year, it was their last chance to get recruited to play professional. So this could decrease the quality of life and increase the feeling of hopelessness. And then the sense of loss of control, like their life is no longer in their hands and they just have to rely on the doctors. And anxiety would be worrying that they will be out for too long and they'll lose their muscle strength, or that they will be permanently injured, and just anger about their situation. And then economical would be for scholarships. If you're injured and can no longer participate in the sport, you're not going to be guaranteed the scholarship and be able to still go to the school possibly. And then recovery can be expensive depending on the severity of your injury, like if you had to pay for surgery, education, medications, or constant physical therapy.
Okay, so next is going to be recommendations, and we're going to start off with health policy. So the NCAA, which stands for National Collegiate Athletic Association, aims to provide protection and safety for college athletes. It is also there to prevent, diagnose, and treat concussions. The NCAA collaborates with the best medical organizations, and they do so to promote education, research, and best practices. They also make guidelines. So, for example, for football, their guidelines are like reducing live tackling during practices, having minimal contacts during practice, or having a break at least once a week. And they do all of these guidelines to prevent injuries and safety to all players. Next is they also offer different programs. For example, one would be cardiac health, since heart condition is one of the leading causes of death among student athletes. They also have help for managing mental health and handling interpersonal relationships like sexual assault and domestic violence. Um, the next is they also have insurance policies for all athletes. The first is the athletic medical insurance legislation, which helps students athlete have coverage for their medical expenses related to sports injuries. So out on the field, if they do end up getting hurt or something, their medical insurance will cover all their expenses. The next is the catastrophic injury insurance. This is through the NCAA, which helps ensures that student athlete does not have to pay out of pocket for unrelated expensive. So a lot of the times, the bills will start racking up, but there are some things that um, the players don't have to pay for, and then but they would end up having to pay the extra money from themselves for the medical bills. Next is recommendations, but this is for the health research. So the biggest health research for student athlete injuries is head concussion and impact. So head concussion and head impact injuries is important to research because it has long-term risk. It is also a major public health problem that requires a lot of research, clinical care, and public policy. A lot of research also has shown that recurrent concussion in sport is associated with unconsciousness, longer recovery time, delayed return time, and a likelihood of an athlete being out of the game. So a lot of the times these concussions can destroy their career. Um,
And they also do a lot of research to find preventions and safety tips for these players so they can still continue playing their sports. And some long-term risks includes cognitive decline, and cognitive decline is when a person has problems remembering, learning new things, and making decisions. So some symptoms includes impaired judgment, confusion, and poor motor skills. Next is neurobehavior changes, which is really common after like a brain injury. So if you get hit in the head or something like that. Um, so neurobehavior changes is how you act, is which is how you act, is how you change your act, and but to other people they would describe it as like a personality change. So like usually your social behavior would change, as well as like some personality traits that may show up is like aggression or lack of empathy. Last is neurodegenerative disease, which affects the neurons in your brain. This can cause a lot of problems with movements or mental functions. And the next slide is our bibliography.
Now we're gonna demonstrate our activity. I encourage you guys to get up and participate.
Okay, so before you work out, it's important to do some dynamic stretches to make sure your body's warmed up. So to begin, we're gonna do some jumping jacks. So we'll do 10 jumping jacks. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
So for the next stretch, we're going to do 20 side twists. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
And then for the next one, we're gonna do 10 toe touches. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
And then for the next exercise, we're gonna do what's it? High kicks. Okay, high knee jumps. So we're gonna do that for 15 seconds. Ready, set, go. 1, 2, 3. Okay. All done.
Stephanie, and today we're going to teach you the proper ways to stretch, and we're going to do each stretch for 15 seconds. So our first stretch is the toe touch, and you just bend over and touch your toes. Okay, and then the next stretch, you have to get in a wide stance, and then we're going to go to the right side first, and bend down. And then stand up and go to the other side. Okay, and then for your next stretch, you're going to do a side lunge. So you can stay in your wide stance and then bend your right knee to come down into the stretch. And you stand up and switch to the other side. And stand up.
I'm Ivana, and I'm going to show you some arm stretches. So the first one would be you put your arm across your body, and with your stretch would be you will put your arm over your head, and with your other arm, you will grab your elbow and pull for 15 seconds. Okay, next would be with your left arm, same thing. And lastly, you put your arm over your head again, and with your other arm, you would try to grab your hand and pull as much as you can. Next, same thing with your left arm over your head, and try to grab with your right hand.
My name is Jeanette, and here's a couple more poses to show you guys. So the first pose is side reach, so you're gonna step far apart, and then with your right arm, you're gonna put it over your head, and then you're gonna reach down for 15 seconds. And then you're gonna do it with your other hand, which is your left hand, for another 15 seconds. Okay, and then the next stretch is your torso rotation. So what you're gonna do is you're gonna put your hands on your waist, and then you're just gonna rotate your body to the left side for 15 seconds. And then you're gonna do another 15 seconds on the right side. And then for the next pose, you're gonna intertwine your fingers together, but you're gonna do it on the back. And then you're gonna just press your chest out, and you're gonna stretch your arms.
Hi guys, my name is Jeremy, and we're going to show you 3 more stretches. And the first stretch is going to be, you're going to hold on to your right leg first, and you're going to hold it for 15 seconds. And then you're going to do it to the other side for 15 seconds. And then the next stretch is going to be a lunge. So you're going to do it on your right side first for 15 seconds. And then you're going to do it to the other side. feet together and then go down as far as you can for 15 seconds.